1 week from tonight, give a few hours, starting at midnight in Newfoundland, the use of cannabis will be legal in Canada. But is Canada ready? Joining me from Toronto, Pam Palmater. Pam is the chair in Indigenous Governance at Ryerson University. Munisa Sheikh is an employment lawyer and partner with Levitt LLP. And Sean Speer is a senior fellow with the Macdonald-Laurier Institute. Munisa, let me start with you. Are we ready to go on this?
Absolutely not, Carol. So many problems. Where do I start? If only I could take all the panel time to myself, but I know I can't. I'm going to talk about it from...
No, you can't.
No, I can't. I'm going to talk about it from an employment perspective. So from an employment perspective, we've got multiple problems. So number one, with the legalization, do employers need to change their policies? The answer to that is yes. The big problem with that, unfortunately, is that employers have little guidance in terms of what those policies should look like. Secondly, there's this whole issue of medicinal marijuana, and are employers obligated to allow the use of medicinal marijuana? And a lot of employees are under the impression that the answer to that is yes. However, there's a whole accommodation process that needs to come into play. And again, with such little information on the levels of intoxication and how it may affect your work, employers are not prepared. And then finally, Carol, there's this whole issue of a zero tolerance policy. And is it fair to implement a zero tolerance policy with legalization around the corner? Now, here I'll tell you what's grossly problematic is we have some of our own police forces who are kind of saying, I don't know. And as a member of the public, when the police are saying we don't know, that worries me a little bit. I'm sure your other panel members know about the Calgary case as well, where they implemented a zero tolerance policy.
Yeah, you know what? Let me put that up since you brought it up, and let's go to the board on what different police forces across the country are doing. The policy, as you point out, Munisa, of police forces across Canada are all over the map. Today we heard what the stated policy, cannabis policy, will be with the RCMP and the armed forces. It will be no consumption for 28 days before reporting for duty in the RCMP, and 8 days in the Canadian Armed Forces. Now, obviously, that is it's different for some members of the forces, those, I believe, who have to work on airplanes or in submarines. They're back to the 28-day policy. All right, so that's on the table. Pam, let me go to you. What do you think? Are we ready?
No, I don't think we're ready. I mean, we were ready for the decriminalization part of things, but not so much the legalization. I agree with the formal panelists. We're not even ready in an HR context. But I think about the health, safety, and well-being of women and children, for example. So any increased use in marijuana and the defense that men will bring to sexual assault claims. We already know that's starting to become a problem with alcohol in some of the most recent judgments, and then also around children. What will the rules be for early child care workers? What about teachers? What about people who work with disabled people and people with mental health issues? And we all know that impairment is impairment, whether you're on a prescription drug like Tylenol 3 or marijuana. Impairment is impairment, and we're talking about, the health and safety of some very vulnerable populations.
Okay, two not readies. Sean, where do you stand?
I'm a bit surprised, Carol. Who would have guessed that Stephen Harper's former advisor would be more comfortable with the transition than Munisa and Pam?
I'm surprised.
I think waiting for the policy and all of the various considerations to be fully baked is inevitably will inevitably lead to an action. We can't let the perfect be the enemy of the good here, and I think the fact that we're doing it in a way that leverages federalism, a way that allows the provinces to function as laboratories for experimentation, will help us get through some of these inevitable issues and kinks that I think, as Bill Blair himself has recognized. I envision that over time we'll start to see convergence across the country on the best practices, the best ways to handle many of these issues. But the fact that the provinces are going about it in different ways, I think, is a virtue, not a vice, and will help us work through what are legitimate and credible issues, but ones that I don't think are ultimately insurmountable.
Carol, may I respond to that?
You may. I was just about to ask you to do so.
Perfect. So I guess a couple things, Sean. So I think what I hear you saying is, in some areas, it'll be safer to deal in a regulatory space, and once legalization has already kicked in. And I don't disagree with that entirely. So a really good example, for instance, is there's been a lot of discussion in the recent weeks around police training in general. I think the province was looking to have 2,000 officers trained, but as recently as May, I don't know what the number is now.
It's 880 police officers in Canada trained. The Canadian Association of Chiefs of Police say there should be 2,000 trained to track down high drivers.
So in that respect, I do actually believe that that training will do, once we're actually in the regulatory framework, I think, you know, it'll be better, and I think we'll ramp up that training, because I can tell you it's not just a numbers game. As somebody who works in the Me Too space and has trained thousands of employees in the last few months, I don't think that was the issue. However, moving back to the HR issue, I mean, we've got the Calgary officers case. We've got a number of officers who are saying, look, what I'm doing on my personal time, where there isn't the medical evidence that would support that the level of impairment that I'm going to have 5, 7, 8, 9, 10, 28 days later is not going to affect my ability to do my job. Admittedly, when talking about the police forces, these are inherently dangerous professions. But let's look at the TTC case, for instance, where there was a woman who said, look, my doctor said, get off the opioids, get onto the medicinal marijuana. And the TTC, pardon me, says, and they're dealing with a bunch of issues around discrimination on this issue, that forget the opioids, we want you back on the opioids, and our doctor says get off the medicinal marijuana. So I think in the employment perspective, there's a lot of issues that should have been dealt with far before the legalization took place.
How could they be dealt with before the legalization issue took place?
Research, Carol, research. The Canadian
but from where? From Washington, Colorado, or do these things inevitably have to end up going through the courts and being tested that way?
There are advocacy groups here. I believe it's the Canadian Mental Health Association is the only organization that I know of that has a few million, and they said, hey, we're going to be pumping out a study that's going to be available to the public before legalization. I don't know that it's become available now, and so what we have is a bunch of Canadians tapping into American resources when we don't even know if those resources can be substantiated here in our Canadian courts. So we're kind of digging. It's like we're out in the wild, wild west, and it's a scary place to be when we're talking about drug use, Carol.
Okay, Pam, what do you think?
Well, I think there's another issue to all of this too. So the fact that all of the provinces will be doing their own thing can lead to chaos, especially for certain communities. If you look at First Nations, where provinces have no jurisdiction on reserves, they don't get to decide what will and won't happen in terms of cannabis. And the fact that First Nations overall haven't been consulted on this law, there's no separate process for First Nations. All of this is going to, it's still going to impact this issue of criminality. If you look at tobacco, that was a traditional practice long before Canada was ever settled. It's now been criminalized in the First Nation context, so that First Nations who engage in their own jurisdiction over tobacco are criminalized. And I can see the exact same thing happening in First Nations across this country who are not going to use provincial or federal laws. They're going to use their own laws. The perspective for criminalization of a certain few, yet former police officers and drug enforcement agencies and politicians are the ones that are standing by to profit from this. So we still have a bit of a criminality issue for this.
It'll also disrupt the market, right? The way that we saw with tobacco.
Yeah, of course it will. And who's doing the licensing and who's doing the selling and under what conditions? And if that's going to be different province to province, imagine the legal chaos in trying to address this nationally.
I think there is going to be a legal chaos on that issue, because when looking at sales, while private companies are permitted to sell marijuana, of course, it is the province, as I understand it, that's going to be handling the sales. And I can tell you as a lawyer, and I will say, Carol, I'm not a privacy lawyer, but I'll tell you our legislation is dated. I mean, this is legislation that was introduced 20 years ago when Google came into place, and it really is not up to snuff as far as I'm concerned, which is why earlier this year we had Minister Navdeep Bains, who I think recommended 19 changes. So when we talk about privacy legislation that isn't up to par when looking at marijuana legalization, that's a huge problem. We could have private information that's leaked to, the U.S. So if you have Canadians that are traveling over to the U.S. In a state where it's not legalized, that's an issue. You can have that information leaked to employers or prospective employers who then may implement a retaliatory or punitive response, and that's unacceptable.
Are you convinced, Sean?
Well,
that had to do it, Sean. That last one had to do it.
I'm left defending Mr. Trudeau and his government on this issue, which is not a natural spot for me. I guess my point is the government has a mandate to make these changes. It was, I think, a clear commitment on the part of the government in the 2015 election. I think there's even some evidence that it was a definitive one for a lot of voters. We can certainly quibble with how it's managed the file since coming into office in late 2015. I take the point of Pam in particular that there ought to have been more consultations with First Nations.
Yes.
But as I said earlier, if we want the policy to be fully baked before it's implemented, I think it almost certainly will lead to an action. And so at some point we have to jump, and I think now it ultimately is incumbent on the provinces to step up and fill the gaps and ensure that employers and others are clear about the regime. And I think this will ultimately involve a degree of trial and error, but I think we're up to it. And I think it'll be exciting to see the policy innovation, the market innovation, and the way in which this new industry evolves.
Well, Pam, what you're saying, though, if I understand you correctly, is that market innovation is going to be disrupted by the very nature of the regulatory system that's being put into place here.
Yeah, well, everyone always talks about a free market. Well, it's not a free market when regulations are designed to benefit very specific people, very specific industries, especially the licensing and the taxation that's around things like alcohol and tobacco, and now will be cannabis. So it's going to be different in the provinces. I don't know how they're going to even attempt to manage that on reserves, where the provincial law is not going to apply, despite what the provinces probably think is going to happen, and how all of that is going to work out. Plus, you have the markets that will continue regardless of the regulation, and then how that will be enforced.
You mean the black markets?
Well, or the gray markets, yeah, whatever they're being called now.
Right.
Yeah.
Well, let me just put this on the table just before we go. Federal government claims that Health Canada and the province, through regulation, will replace the drug dealer on the corner. Also, we're hearing at the same time CD Howe Institute saying that the recreational demand will exceed the supply. Let me go right down. Let me ask everyone. Muniz, I'll start with you. What do you think? Is this going to replace the drug dealer on the corner? Are they gone?
My concern, Carol, goes back to my concern around the privacy legislation. I think our privacy legislation is not up to snuff.
Okay.
And my concern is that where individuals who are buying online are going to have to provide their contact information, that is information that may potentially become available and be leaked to the black market. That's a serious concern that I have. Okay. And again, that isn't necessarily something that needs to be dealt with today. We need a whole revamp in terms of privacy legislation.
Carol, I think your question is the real test. The government's public motivation or public rationale for the policy has evolved at various points. It was initially about individual liberty. At times it's been about public health, but they seem to have settled on a case around public safety and driving down the black market. I think that will ultimately be how this policy is judged. And the truth is, I don't think we have a good basis at this point to have a working hypothesis, but that's certainly what Mr. Blair and the government are saying, and that's, I think, how this policy will be judged.
Pam, what do you think? Last word to you on that.
I don't think it's going to replace the black or gray market. I mean, because there are so many gaps in what kind of weed and what forms will be allowed. So ultimately, they're going to... Yeah, exactly, and age. So wherever there's a gap in legality, of course that market is going to cover that, if not the other one, if you took, you know, especially in remote areas where there may not be easy access to commercial sellers and things like that. So I don't see it going anywhere anytime soon.
Pam Palmater, Muniz Sheikh, and Sean Speer, great conversation tonight. Thank you.
Thanks, Carol.
Thank you.